Attention Deficit Hyperactivity Disorder. Hello friends, I am physiotherapist Meghna Dave and welcome to YouTube channel HealthQ, the place where our mission is to not only motivate you but help you to move on to the brighter side of the health. We come up with unique videos on different health topics, and Wednesday videos we have dedicated to children's health. So most of the time we have created videos around cerebral palsy, autism, etc. But we have rarely covered this common trait which we have seen in children, which is ADHD, which stands for Attention Deficit Hyperactivity Disorder. So many parents these days are troubled with this problem. Some of them assume that is my child having this problem, ADHD? Some of them know and are trying to work towards it. But do you exactly know what is this problem? If not, then make sure to watch this video till the end, because I am going to simplify and help you understand what exactly ADHD is all about. So without wasting any due time, let's get started. Friends, ADHD is one of the most common neurodevelopmental disorders seen in children these days. The prevalence is increasing day by day. In this problem, the child is having trouble with paying attention. He is having trouble of impulsive behaviors, and usually the child stays overly active. Whenever the child who is not able to outgrow these impulsive behaviors, this attention deficit issues are considered as suffering from the ADHD disorder. Many a times it is possible that the child can be very impulsive, can not focus on one thing for a long time, is more distracted, but that does not mean that the child is having ADHD. There is a diagnostic criteria for that. ADHD usually happens due to a genetic ailment, or as you can say, genetic defect. Most of the time ADHD comes from this genetic issues, but there are certain environmental factors as well that impairs or triggers ADHD symptoms. These triggers are brain injury, exposure to lot of environment which has got metal or toxic metal exposure of mother during pregnancy to the toxic metallic environment. If the mother uses a lot of tobacco and alcohol at the time of pregnancy, if the child was delivered prematurely, or the child was low birth weight. Now the diagnosis of this condition is made not by any specific test. There is no one single test that exists that gives the diagnosis of this problem, but there are certain signs, symptoms that are seen over a period of time that can help an individual to identify whether the child is having ADHD or not. Usually pediatrician is the one who would be able to evaluate your child and come to the conclusion whether the child is having ADHD or not. But apart from that, clinical psychologists are also the people who would be able to help you to identify whether the child is having ADHD or not. Sometimes the child shows mixed symptoms with ADHD and autism, which also needs to be ruled out. DSM-5 is the part of evaluation method which is used to identify ADHD disorder. These are certain set of criteria that a healthcare professional usually looks for. In this, persistent pattern of inattention and hyperactivity or impulsivity is checked, and if that is seen consistent, then the evaluation says positive. So these criteria are as follows. Number 1, if the child who is up to 16 years of age and shows a very consistent pattern of 6 or more symptoms or sign of inattention or impulsiveness or hyperactivity, then he or she can be evaluated as ADHD child. If an adolescent shows 5 or more than 5 signs of hyperexcitability or impulsivity is seen, then the adolescent is considered as someone experiencing ADHD. This age group should be more than 17 years of age. So there are basically 3 different types of ADHD that exist. The number 1 type is called as predominantly inattentive presentation, which means the child have problem with finding focus or showing focus on different things. Here the child might not sit at one place for a long time. He finds it hard to finish or organize a task. The child finds difficult to pay attention to the details or to the classroom or else to the environment, or the child finds difficult to follow instructions. You can also say the child is usually or easily distracted by small things around the area, and then the child would be more predominantly an inattentive presentation type of ADHD. The second type is more predominantly hyperactive impulsive type of ADHD or presentation of ADHD. Here the child might overreact to things, the child might talk a lot, the child might be finding difficult to sit still at one place. If the child is small, he or she may run, jump, climb without getting tired. The child might find continuously jumping, running around despite giving off the commands by the elders. The child feels restless all the time and have troubles with impulsivity, which means he or she can overreact to the scenario. He can cry, jump, shout whenever the things are taken away from him or her. The child interrupts very easily to others' talk, grabs things from people and throw away, speak at inappropriate times, and can have multiple falls and injuries repeatedly. If that is the case, then the child could have a more of an impulsive type of ADHD. Now to evaluate this, there is an evaluation method which is used, which is called as DSM-5. In this, the child is observed for certain patterns. If a child shows more than 6 signs of inattentiveness, which is below the age group of 16, then he or she can be kept as a person or child suffering from ADHD. The first one, if the child shows the sign of 6 or more signs of inattentiveness, and an adolescent who is more than 17 years of age and shows 5 or more signs of inattentiveness, then the child would be called, or else the person would be called as inattentive type of ADHD. And if a child or its adolescent shows 6 or more signs of impulsiveness or hyperactivity, then he or she can be classified as someone experiencing an predominantly hyperactive or impulsive type of ADHD. Now, whatever is the scenario, the management of this problem should be the keystone. Some of the common signs or traits that an ADHD child shows could help someone to identify, or is help parent to identify whether he or she is experiencing ADHD or not. For example, if a child daydreams a lot, if child forgets things a lot, if a child talks too much, if child makes unnecessary risk, takes unnecessary risk and make careless mistakes even though after growing up, if the child have got high difficult time to resist temptation and start impulsively crying, if child have trouble taking turns, and if the child has trouble getting along with others, then the child could experience ADHD. So now you know the criteria, and you also saw some of the common traits that an ADHD child showed, but it's not necessary that all the child have it, because there are certain criteria and it's important to get it checked or get it assessed by a professional. Along with these problems, there are also few signs that this child might show which you should look out for. These are, if a child is 12 years and older than that, and still if the hyperactivity and impulsiveness don't come under control, then it is a sign that it requires work. If the signs and symptoms of hyperactiveness or inattentiveness or impulsiveness is present more than 2 or 3 times, or more than 2 or 3 episodes, at that time also you can go and get it evaluated. If there is a very clear sign that your child's quality of life is getting affected because of these impulsive hyperactive issues, then also it's important to get it checked, get it identified. And if the symptoms are not coming under control despite you taking effort to reduce them, then also it is important to get it identified. Make sure this problem needs to be addressed and can be addressed by professional help, so don't hesitate in taking so. The treatment mostly comprise of psychotherapy, or else you can say behavioral therapy and medication, occupational therapy, and sometimes physiotherapy if there are some motor components that the child is showing, or else movement related components the child is showing. Behavioral therapy is the key area here, where the therapist not only works with the child but with parent as well, because there's a lot to do and a lot of modification from a parenting standpoint is needed. And Most of the time, behavioral therapy is considered as the first line of treatment even before trying any medical management. Some of the important ways that can be used to manage the symptoms of ADHD at home, I would like to share with you are: number one, make sure to have a healthy lifestyle. There are studies which have shown that if the child is put on to a very healthy lifestyle, then child can show reduction in the symptoms of ADHD. For example, having a healthy eating habit. Second, doing regular physical activity helps child to release some happy hormones, reduces the impulsiveness. So it's important that the child is having a regular physical activity regime. Number three, encourage the child to participate in your day-to-day chores. With that, your communication with the child improves, the child's ability to focus also improves, and the child can learn to make sense and can connect the dots in the brain. Number four, music therapy is a very important aspect, an integral aspect of helping the child recovering or dealing with ADHD. Music have got calming effect, beneficial effect and neuroplasticity effect as well. So make sure to work through music therapy with your child. Number five is limiting screen time. Screen time have a negative impact on your child's mental health. Hence, make sure to have a check on its limitation on the screen time with your child. Last but not the least, give your child adequate amount of sleep. The more the child sleeps, more he is rested, the more brain develops well, and this is helpful in keeping the symptoms of ADHD under control. So this was a brief about ADHD. I hope I was able to just scratch the surface and give you an understanding around it. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.